Dr. Tom Roselle live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio. 888-630-9625, 888-630-WMAL. Love to talk to you on any subject you have in mind. Perhaps you've had a problem, you've tried, you've applied. Well, this is your opportunity to find out what really can make a difference after all those things that you've done didn't work. You got that? So here's the place, 888-630-9625. Have some very interesting information for you, things that have come up in the news. We're going to talk about that today and see if we can change a few things about what's going on in your life and making a difference relative to your health, your wellness, and potentially becoming those things that you've forgotten that were possible. This is why I'm here. That's why I do this program every week. Want to remind you, want to get you to take action today. October the 20th, 2012, Ageless Health. That's our annual event. That's when we go from early morning to late in the day, and we bring you the most cutting-edge information for you to help yourself. Ageless Health 2012 this year will be held at the Fairview Park Marriott Hotel in Falls Church, Virginia, right off the National Capital Beltway. And it's how to live well in a stressful world. We're going to be talking about all types of things. We start out early in the morning, for those of you who have been there before, with core training exercise. We're going to take you through and show you and demonstrate to you and so forth, whether you're sitting in your chair or whether you're actually able to get up on the floor and do whatever. This is an opportunity to really get it started. And then we start out, bang, and I lead in, and we're going to get together with some very powerful information. This year, a very special guest, somebody who is very dear and near to my heart. Dr. Evan Mladenoff will join us. Dr. Mladenoff is a chiropractor out of Kansas City. He spent 12 years with the Kansas City Chiefs as their primary chiropractor, applied kinesiologist. Brilliant guy. He wrote Stressed Out, Headed for Burnout. Very, very well-known author and lecturer throughout the country. Opportunity to see Dr. Mladenoff and talk to him both in and off the program. So October the 20th. Right now is your opportunity to get an early bird special and save some money. If you go online to rosellecare.com and click Ageless Health 2012, then you'll see all the information that you need to know. You can save 15% if you register now. And this day, for those of you who've been there before, and by the way, you have a very special invitation coming your way. Make sure that you read it because you can save a little bit more. But we're going to have an organic lunch for you like we did last year. We're going to have vendors that I think are going to be exciting to you. Be our guest. Join us. Love to have you. I promise you it'll be a day well worth spending with us, and you'll go home with more information than you can possibly imagine. Meantime, we're here at 888-630-9625. That's 888-630-WMAL. Let me hear from you. Let's talk about your problems and what's going on and see if we can put a fix to it. Interesting article, and something that I've told my patients over and over again, be very careful taking any of these over-the-counter NSAIDs, the non-steroidal anti-inflammatories. There's a substance out there. It's called acetaminophen. It comes by many different names and labels. But here's the deal. Liver damage can come about because you use this stuff regularly. And not only is it a chronic application that causes liver damage, but also the dosing is extremely important as well. When you have a fever, we're so quick to put the fire out. We don't want to suffer the ache of the fever and so forth. But what we forget is fever is our friend, whether it's an adult or whether it's a child. It's there for a reason. It burns off the microorganism that's invaded your body. But fever is a normal response to any kind of bug or pathogen of any kind that gets into your body. Far too many people look at this as a problem, and it's really not. And then we hit it with these NSAIDs or the acetaminophen. And no matter how high it is, it can slightly above. If you're running a 98.6 or your normal temperature is 97.9, you get a point above that, you start feeling a little uncomfortable, and you reach for that bottle of acetaminophen. And a lot of you, if you've noticed, if you've gone out and got a vaccination, a flu shot or whatever, and you get you reach for a bottle of acetaminophen in any brand name, you want to try to put that fever out, right? Well, your body's trying to tell you something. It's trying to tell you that that vaccine in your body is not supposed to be there, and it's not only setting up an immune response to it, but it's trying to get it out. It's trying to dispose of it. So the immune system is targeted specifically to go after any of these invaders. And we get a little uncomfortable, and we give ourselves acetaminophen in large dosages, but we also give them to our children. And it's an unfortunate situation because the side effects are horrible. A recently published article in a very well-known medical journal, The Lancet, demonstrated that when you give a child acetaminophen, the immune response in the body suffers. It actually suppresses it. And we have kids that not only, if you even thought the vaccine was going to work at that point, it decreases the vaccine's capacity in the body, but more so that it can set up a child, a very small child, sometime for something called Reye syndrome, and a lot of deaths have been reported because of that. When the immune system is decreased in response to any of this stuff, because you've got the injection for the H1N1 influenza virus this last year, and, we're in such a rush to vaccinate everybody that we don't realize that we can overdose on this stuff and cause significant permanent problems. Fatal bleeding in the intestinal tract is another side effect. Ulcerations, not to mention something mild like just your stomach doesn't feel good. The liver tries to metabolize, meaning it tries to get this acetaminophen out into a toxic metabolite form, and it's called NAPB, or N-acetyl-P-benzoquinone, and the problem is that it depletes something that's very important to you. It's called glutathione. Glutathione is what decreases toxic reactions in the body. It's produced in the intestinal tract. The liver utilizes it in great amounts, but if your intestinal system isn't working or if you don't have enough of it, you have a problem. And unfortunately, one of the side effects is death, and you have to be very, very careful. A lot of articles that are coming out now on the use of acetaminophen relative to brain injury and kids with autism and so forth, and the story goes on, and we'll try to continue to keep up with you as time goes on with all this information. You need to know it's important. You can't turn your head away from it. Don't think it can't happen to you, because it can. Remember all those commercials on television that Fifth Avenue Marketing wants to put out? Well, and then they have the byline, in case of blah, 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 and by the way, you might die. But it still works, right? So you think it does. Not a good thing. 888-630-9625. That's 888-630-WMAL. Let's go to the phones. Bill, how can I help you? Thank you for calling, sir.
Yes, good morning.
Good morning.
Good afternoon, actually.
Well, indeed it is. But, it is morning any place that you want to go. When I go to China in a few weeks, the morning is going to be our nighttime and so forth. So I'm confused already. Anyway, Bill, how can I help you?
Okay. This is the problem. For the last 5-6 days, I have a tremor in my scrotum area, like my testicles and my shaft.
Okay.
Tremor comes and goes.
Did you fall? Did you hurt your low back? Did you participate in some activity that you normally did? Have you been riding a bicycle?
No.
Okay. Have you gone to the gym and done anything on a treadmill or an elliptical machine?
I haven't been to the gym. No. I'm just under a lot of stress.
Okay. So what can happen, it's one of those areas, the nerve that goes there is the S1, sacral 1 nerve root. It comes out between the lumbar 5 vertebrae and the sacral base. And if that area of your back is irritated in any way, you don't have to have back pain, but you can have pain at the site of the innervation of that nerve. So it can go to the scrotum, it can go to the testicles, it can go to the perineal muscles, and it'll feel like the muscles in spasm or even cramp. Mm-hmm. So there's two things I would tell you to try to do. One is very simple. Go get some magnesium and about 250 milligram tablets or 200 milligram tablets of magnesium glycinate, and start out taking 3 a day. And then also go get a very low-level vitamin B, like Boy Complex, and whatever the dosage is, take 1 twice a day, but low level. But I want you to go to a store like Mom's or Trader Joe's or Whole Foods and get an organic form of both of these things. And take that in the dosage I just told you for a few days. Get a hold of me through my website at rosellecare.com. Let me know what the outcome is, and then I'll tell you what else. If that doesn't do it, then it's a low back problem. And the stress that you're going through is causing the low back to cause the nerves to be irritated. So, Bill, let me know. That should help, and let me know what the outcome is.
Okay, thank you.
You're welcome. Annie, How can I help you?
Hi. I'm calling because I have a 13-month-old daughter, and our pediatrician has been pretty good about letting us, dictate what vaccine she gets and what she doesn't. But lately, the doctor's been really pushing Prevnar on us. And I'm not really comfortable with it, but I haven't been very lucky in finding any literature that can back up that gut feeling for me. And I was just wondering if you could give me any guidance.
Well, give me a little bit more history on your daughter and what's been going on and what brought it to this place, if you can.
It's just her father and I are a little concerned about the vaccines. We have a couple of friends with children who are on the autism spectrum, so we've been delaying or just flat out denying certain ones. And it's just for some reason her doctor is adamant that, and I stay at home with her. She doesn't go to daycare. She doesn't really do anything that would bring her into contact with tons of other kids.
Yeah, well, Prevnar is a substance that's used for fighting pneumococcal types of problems, particularly that affect the lungs. Mm-hmm. And they give it to kids, infants and children and so forth, and they're looking to go after the Streptococcus pneumoniae microorganism. And in my opinion, it's one of those things that we're too quick to expose our children to because of all the stabilizers that they put into the vaccines and so forth. And first of all, in my opinion, it doesn't work. But what it does is supposed to protect the cellular membranes from invasion of these pneumococcal bugs. And unfortunately, if you look at the literature, the kids that are actually being prevented, they say that they're at the highest risk, and I think they look at kids that are about 2 years old up to about even 4 years old. The data's not there. It's not all in. And, if it was my child, and I can only tell you what I would do with my family, they wouldn't be getting it.
Yeah, well, like I said, that's my instinct anyway. What she's been using is kind of I don't want to call it a scare tactic because in a lot of ways she's a really great pediatrician, but she keeps talking meningitis, and of course that sets off alarm bells for me because, okay, you've got another vaccine for meningitis.
Well, it's this. They got one vaccine after the other. I have a young girl right now that's a patient of mine since she was a child, and she's getting ready to go to college in the fall. And this girl has not, for the most part, has had no inoculations over the years. So she's going to the school in the South, and for her to be admitted into housing, they want her to have the meningococcal meningitis vaccine. And most of us in the northern area are carriers. We've been exposed to this thing 1,000 times. So my whole point with vaccinations is simply this. Those of us who have chosen not to vaccinate for whatever reason, whether they're moral, ethical reasons, or because of medical reasons, and we know what's in the carriers of these things, the point is that the kids who are at risk are supposedly from us are the ones that are getting vaccinated. So let them get their vaccination. But you and your doctor or someone like us who knows the side effects need to make that decision. If it was my child, again, I can only speak for my family, wouldn't be happening. So okay. If you'd like to have more information, call our office and ask to speak to Dr. Jennifer Sims. She's our pediatric specialist, and she can tell you what your options are. I could spend the whole program on this. Unfortunately, I can't, but you can get a hold of us at rosellecare.com. But call Dr. Jennifer Sims, at 703-698-7117. Annie, thank you for calling. I appreciate it. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in the studio, 888-630-9625. That's 888-630-WMAL, broadcasting to you from 105.9 FM and AM 630 WMAL every Sunday at 12 noon, giving you the most intimate and up-to-date information on integrative care. That's why we do the program, is to help you have a better life and do the things that are more important, like enjoy your kids and have fun and, work out and go to movies and things like that. So, we're talking about vaccines and problems. An interesting article, matter of fact, many of them have recently been published, but there's one called Serum Vaccine Antibody Concentrations in Children Exposed to Perfluorinated Compounds. And this was published in the Journal of the American Medical Association in 2012. And so just recently, the study is interesting, and the study in this particular situation talked about tetanus and diphtheria and toxoids in children 5 to 7 years of age. Bottom line is that the significance of damage in neurological pathways and immune system is profound. You need to look this stuff up for yourself. I may get back into it as the show goes on, but I want to get to your phone calls. Jerry, how can I help you? Thank you for calling.
Roselle, a happy Sunday to you. I want to go back to the beginning of the show, and some people might recognize my voice, which is fine, but we'll leave it at that.
Oh, hi, Jerry.
I wanted to refer back to your warning about Tylenol to folks by saying that I had long-term pain, like most people, an ache and a pain here and there, and particularly back-related. I've had a few operations down around my body, and I was taking very heavy doses of Tylenol because first we were told not to take this, and then we were told not to take that. But Tylenol is in all kinds of pain relievers. So I went in for an operation on something else a few months ago, and when I woke up from surgery, the doctor told me they couldn't do what they intended to do because when they opened me up, they found half of my liver was diseased, that I have non-alcohol-related cirrhosis of the liver, and that they're saying it was probably, almost certainly, a result of long-term high usage of Tylenol over a period of 10 years or more.
The number one cause of liver failure, Jerry.
And which takes me back to the question I thought you could most help a lot of people with, which is, if we can't take aspirin because it thins, interferes with blood clotting, if we're not supposed to take Tylenol or Advil or any of the NSAIDs, what do you take for pain?
Jerry, there's a lot of different things that you can do. It depends on the pain pattern. It depends on the extent of the metabolic problem, the functional condition of the patient. So you have to be very careful in what you prescribe. Sometimes things that are as easy as the proteolytic enzymes, the amylases and bromelains and proteases and so forth will decrease the inflammatory response in the body that will work well. Depends on the organ system.
Okay.
So you would look at it based on the patient. Somebody like, and I know your history, and we would have to be very careful. Acupuncture and low-energy light laser and detoxification would decrease your pain pattern significantly. So, again, you have to look at the patient. With the history that you've had, to go after it with more toxic elements is just going to make you worse. It's going to make you sicker. And you have to be very careful. So you take, and first of all, take away the things from the body that are causing inflammatory responses, things that are suppressing T-cell and increasing the pro-inflammatory COX-2 inhibitors, and those are the things that you work on first, but you can get tremendous relief, and you can turn a lot around. You and I have talked about it before. And
Sure. And I'm trying to generalize it out a little bit from my specific situation to all the warnings that people are getting now. I mean, if you have a headache, you scrape your elbow, you bang into the wall.
Take this drug. And the problem is that we start destroying our liver and our kidney and our immune responses, so we're more susceptible to everything else that's out there. And once we get to a place where the body can no longer respond, we collapse, we fold, we have nothing to fight with. And that's what takes place. We look at the structural, chemical, emotional pathways in everybody when you handle any type of situation. If you approach those things properly, then life can be different. So again,
thank you. I'm just trying. I am living for the moment, walking, breathing evidence of the damage that I would have had. I had no idea of in the world that the acetaminophen, the Tylenol could do, and I don't think most people do.
And they don't.
Even worry. Yeah.
They don't, Jerry. Jerry, give me a call. I'll talk to you further about it. You and I need to discuss it. Appreciate it. Thanks for giving me the jingle. We're coming up to a break and the news. Have a lot of information for you. There's a lot of people online. I will get to you. Just be very, very patient. We're going to come back. I'm going to also talk to you about rice consumption contributing to arsenic exposure in women. Interesting topic. It's been out there for quite some time. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. I am in studio. 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're on a lot of different topics today. Love to entertain yours. And also want to remind you, October 20th, 2012, Ageless Health, How to Live Well in a Stressed Out World. Right now, early bird registration. Get online, rosellecare.com. That's how you go there and save 15%. It's a day that you'll never forget. I promise you, it'll be worth being with us. It's amazing. Dr. Evan Mladenoff, Kansas City, is going to be our special guest. Dr. Mladenoff was with the Kansas City Chiefs for 12 years, and we're going to talk to you about the emotional side of healing, of all things. And I think you're going to find him extremely entertaining and very fascinating. October the 20th, go online, rosellecare.com, ROSELLECARE.com. Robert, how can I help you, sir?
Dr. Tom Roselle?
Yes, sir. How can I help you?
This is, I'm 74 years old. I've had automobile accident about 5 years ago, and the result of that is fused vertebrae in my neck and lower back.
I'm very sorry, sir.
6 vertebrae in my neck and 5 vertebrae in my lower back. I'm also an open heart surgery survivor. I had open heart surgery and 1 bypass, and a pacemaker put in during the time I was having the other operations. I'm in pretty much constant pain, moderate to.
Have you done anything besides medical intervention? Have you gone through? Have you had any acupuncture? Have you had chiropractic care, osteopathic care, anything like that?
No, I'm taking narco every day.
Okay. So
4 tabs of narco.
All right. So let me tell you a couple things.
Doctor, the problem is 3 days ago I took Ambien to go to sleep because I have problems sleeping.
Not a good combination with the other stuff you're taking.
And I don't know what happened, but apparently I made a lot of noise in my apartment. My next door neighbor pounded on my door. I don't remember anything that happened clearly, but I ended up in the hospital. Yeah,
it's going to cause a psychogenic reaction, and you can go into hallucinations with that type of combination. When you're taking a narcotic and you add Ambien to it, it's one of the things that you should never do. If you go online to drugs.com and you look up the combination of the two, one of the side effects is hallucinations, and you compound it with everything that you're doing, and now you've got, unfortunately, some of the stuff that you just went through.
Yeah.
So you've got to get to somebody who knows what they're doing with those medications. Number one, the pain that you're in has to be evaluated by somebody who understands functional neurology. Dr. Harlan Browning in our office is a guy that specializes in that. We look at those things.
I'll call you in your office. We'll go from there.
More than happy to take care of it. And you can get a hold of us online. But, Bob, this is not something that you want to play with. They've got you so drugged that you're going to have other problems other than what you're experiencing. Appreciate your call. Thank you very much. Jeff, how can I help you, sir? Thank you for calling.
Yes, I work outside like 50, 60 hours a week, and I'm just curious about types of sunscreen. Are there certain types that should be avoided, some types that are better, what can be done? I don't want, skin cancer 20 years from now.
Most sunscreens are pretty awful things because they end up causing some of the things that they're actually trying to prevent, and that's skin cancer. And it's because of the different types of combinations of products and so forth, they cause the cells to break down. So let me give you a couple suggestions. First of all, you want to make sure that your essential fatty acid levels are adequate. That's your omega-3 fatty acids. So you want to get a good form of that. Go to one of the health food stores. I would encourage you to take a minimum of about 1,000 milligrams of omega-3 a day. You want to make sure you're taking something like calcium lactate, which actually helps begin to cause tissue to be more stable. Those two things by themselves will help. Now, relative to sunscreens, things that contain zinc oxide are not terrible, but you use those on your lips and your ears and nose and so forth where you have direct innervation. Hopefully you're wearing a hat when you go out and that you're keeping yourself covered. Because even, if you think you're covered up with sunscreen, you're still going to get sun. California Baby is not a bad one. If you call our office, there's a doctor down in North Carolina by the name of John Schmidt who just formulated one of the best sunscreens I've ever seen, and we will give you the name of it. I'd give it to you on the air, but I can't think of it right now. Or get a hold of me at rosellecare.com, and I will be more than happy to send it to you. But John came up with a really great product that seems to work fairly decently, and we'll hook you up with it, and we'll tell you how to do that. But there's a couple others that work equally as well. But your first thing that you want to do, that's one of the reasons that Mediterranean people don't burn easily, is because the amount of olive oil and fish and so forth getting into their body is adequate enough that gives them some protection. And so you want to increase that level of omega-3. So give me a call. I'll help you out as best I can. Thanks for calling.
Bye.
It's the sun is one of those things that is good for you. You have to have it. We always talk about not enough vitamin D, and the sun is the primary source of vitamin D. We need to be out there for at least an hour. So you have this catch-22. I need the sun, but I know I'm going to burn. If I burn, I risk the level of skin cancer. Well, the truth of it is, if you get sun in the morning, early on, before it becomes very, very bright, and you get sun late in the day, so anytime after, 3 o'clock and up until about 10:30, and you're out there, and don't put any sunscreen on that time. Let it stimulate your skin, because that's the only way that you're going to get your vitamin D. Once you put sunscreen on, and by the way, once you wash with soap, you can't get as much vitamin D into the melanocytes, or the skin receptors that produce the vitamin D. So go out and, exercise, get in your garden, wear short-sleeved shirts, get exposure to your body and stimulate your cells, but don't take your shower and don't soap up until afterwards. It just happens to be the truth of the way it is. So do the best that you possibly can. Thatcher, how can I help you? Thank you for calling.
Hey, doctor. Thanks for taking my call. I'm dealing with two different things. One is chronic fatigue, and the other is over the years from running 50 miles a week for a number of years, the amount of pain that's in my knees, and I've had to quit running. So I don't know what's out, what options I have for.
Okay, sounds like it's all wrapped into one primary situation. When you run and you get hurt, or you do things and you're sore and stiff, and you compound that with fatigue that just doesn't seem to want to let go, that tells me that we have an adrenal system problem, a functional loss of adrenal production of probably a lot of different pathways. But here's what happens. Your adrenal glands, these little glands that sit on top of your kidneys, put out a lot of different hormones. One of them is something called mineralocorticoid. And what it does, it maintains integrity and balance of the joint spaces, the ligament structure. If you're fatigued, stressed, not eating the way you're supposed to, that organ system is the first one that catches it. It's your fight-flight organ system. It's the one that lets you fight the tiger or run away from it. So pretty soon as it gets depleted, you don't have your own anti-inflammatories. You don't have the nutritive pathways to make your joints solid. So now you do something and you get hurt. The fatigue pattern also can come from that in many different ways. The adrenal glands stimulate something called HPA axis, which is the hypothalamus pituitary adrenal. And they're all tied in to the production of many things, your own steroids, but also the thyroid production of tyrosine, of T4 thyroxine, and if your thyroid is low, you're going to feel terrible. The other thing that it's involved in is the citric acid cycle production of energy formation in the muscle of something called ATP, adenosine triphosphate, and you need specific nutrients that allow your body to take oxygen, transport it into the tissue to be burned. It's that spark that allows things to work and to pull it out. Things like vitamin B1 and thiatic acid, high levels of protein, and so forth. In the situation you're in, you're going to crave proteins, you're going to crave sugars, you're going to crave salty things, but nothing seems to fix it. You could probably get up in the morning, you feel like you need a truck to get you out of bed. But that's all adrenal pathway problems that are due to a long-standing fatigue condition, and it can be neurogenic, it can be acupuncture, it can be dietary, but it can be fixed, and that's the good news. If we can help you, you can get a hold of us initially if you'd like to through rosellecare.com, or give us a call. Anybody in my practice can handle that type of situation. I'll be delighted to do whatever I can for you.
Okay, great. Thank you.
Thatcher, thank you for calling. I appreciate your phone call. Michael, how can I help you, sir?
Yes, Dr. Tom, thank you.
You're welcome.
My questions are around gluten allergies. My sister and my dad, I think, both self-diagnosed that they have gluten allergies and have gone on a gluten-free diet. Both report feeling better.
Okay.
And my sister reports, she's lost a tremendous amount of weight.
Yes.
So seeing this, my wife had suggested, wow, maybe we should do that too.
Okay.
Now, I'm wondering, first of all, it seems like every time I turn the corner, there's another friend or relative that says, oh, I'm allergic to gluten also.
About 50% of the population or more. Go ahead.
Okay. What are the symptoms, and is it practical to reduce the gluten intake? Because I looked on the web this morning, and it seems like all the gluten-free foods that you're supposed to eat are bad for you in some other way.
Well, it depends on what you're trying to substitute it for. For example, I'm totally gluten-free except for maybe 5% of the time, but I don't eat starchy grains. The things that I eat are mostly fish and chicken and some lamb occasionally and some venison. Once a year, maybe I want to or twice a year, I'll get a piece of steak, but it's got to be free-ranged and organically fed. But here, but I eat a lot of wild rice. I eat some brown rice, Indian red rices, a little sweet potato, tons and tons of vegetables. I probably eat more vegetables in a day than most people eat in a week. And
what are the symptoms, doctor?
Okay, so bloating, extension, irritability, depression, fatigue, skin rashes, skin lesions, and it goes on. It can cause all of those things. Liver function problems, blood sugar handling, and there's a lot of indicators now that gluten sensitivities are causing the predisposition, that heavy level of what we call type 2 diabetes that we're seeing in kids and adults. But it's that gut that you can't get off, the cellulite in the body. It can go on. It's individualistic, but you have to look at it. Suppression of different pathways neurogenically, inability to think clearly, forgetfulness. Thanks to Monsanto, we've got 5 to 10 times as amount of gluten in everything that we touch. And that's why you're seeing more and more people that are so sensitive.
Okay.
So if you're going to do it, challenge yourself. Go to a diet that is a lot of vegetables, a lot of proteins. If you want to starch, make sure that it's real wild rice. Indian red rice is the black rice. This is what I just told you. And stay away 100% from gluten for 30 days and see how you feel. Okay. And if you start seeing measurable changes, then you know that you are, and you need to stay away from it. There's things that can be done, but it takes a long time to change the gluten problem. And unfortunately, there's crossover allergens. On May the 20th, I think it's going to be the 20th, Sunday, May the 20th, Sue, my wife, who's the head of our nutrition department, and Dr. Leonard Poe are going to talk about gluten reactions, gluten sensitivities at length. They'll be your host here on the program, so stay tuned and pay attention to that day.
Awesome. Thank you so much.
You're welcome, Michael. Thank you for calling. I appreciate it. Wow, we spent the greatest majority of the program today talking to you, the most important piece of our program, trying to answer your questions and making sure that you get the information that you need. We're going to take a couple more, and then I've got some more data for you. Lisa, thank you for calling. How can I help you?
Thank you, doctor. I have a relative that has diabetes, and their filtration on the kidneys is very low, so it's getting near the place where they will have to go on dialysis. Is there any hope at this point?
Yeah, there's a lot of hope. It depends on whether the patient wants to make some changes in their dietary patterns and get the care that they need. In our office, how we approach this is with diet and acupuncture and low-energy light laser, and we've seen patients who essentially have lost about 80-85% of kidney function begin to turn around and all of a sudden they're at 50, 60% and stay that way for quite some time. So the answer is yes, there's lots to be done. Now, it also depends on whether or not there's kidney failure and disease. Now, if there's disease and degeneration of the kidney, different type of story, but you still can help. So, I'd have to know a whole lot more. I'd have to know what the parallel situations are with this, but kidney problems and kidney failure and diabetes go hand in hand. The burden of kidney failure affects us globally when we get into this type of situation. It's common. Nearly 44% of the new cases that are about kidney failure go into a diabetic condition. And chronic kidney problems, we're talking about maybe 24 million people in this country. It's huge. It's not something that's little. We're talking about predispositions to things like even Tylenol, the acetaminophen that we talked about earlier. Anyway, if you give me a call or get a hold of me on the web at rosellecare.com, I'll be more than happy to give you much more information. But the short answer is yes, a lot can be done, and you don't have to give up hope yet. Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. I'm here at 12 noon every Sunday, bringing you the most up-to-date information right here on 105.9 FM at WMAL. You can always reach us at 888-630-WMAL. And off air and off the program, you can go to rosellecare.com. Send me a note. I will get back to you. Sometimes, because there's so many, it takes me a while, but I will get back to you. It just takes a little longer. If you need to talk to one of my staff members, you can always call us at 703-698-7117 and tell them what the problem is, and one of my docs will get back to you. And go online to rosellecare.com. By the way, if you want to listen to the show again or any other program that we've done recently, go to roseleradio.com. And join us on Facebook as well, because I blog there all the time. Become a friend, send it to your friends, and we're always updating. We're always giving you information, both controversial and otherwise. Take one more call. Laura, how can I help you?
Hi, Dr. Tom. Thanks for taking my call. I have a question. Are you going to have any seminars in our area here, which is...
In Great Falls?
Yeah, well, like Great Falls or Reston or any place. I'd like to come because I have so many things that are bothering me.
We actually this year are going to try to do some seminars in different locations. We haven't set the schedule yet. We're going to try to get into Maryland. We're going to try to get out into the Great Falls, Reston, Sterling area. We're going to do some different things. Haven't planned them yet, but yes, we actually are talking about them, and they will take place.
Because Loudoun County is a big, it's the richest county in the whole of the United States. You know that?
Laura, you're a sweetheart.
So you will have a lot of people who would like to come and see you, and I need to come and see you definitely.
Well, let's see what we can do.
Okay, the other question real quick is, do you accept Medicare?
We file Medicare. How we handle Medicare, you can do it one of two ways as a physician. You can either accept Medicare directly from the government, but then they limit what you can do and how you can treat.
Right.
Or you can treat and bill the Medicare fee, because it's a substantially reduced fee, and then Medicare reimburses you, the patient, directly. We do it that way.
Okay.
So the short answer is we participate, but we participate in that way.
And by the way, I didn't find the glycinate, magnesium glycinate. I am looking all over.
All right, just
everywhere.
Then try either, if you can't find the glycinate form, if you can find aspartate, that will work, and or magnesium citrate if you can't find either one of those.
All right. Thank you so much, Dr. Roselle.
Laura, thank you for calling.
You are a treasure. We love you. We love your show, and it's very informative.
Laura, thank you for calling. I appreciate it. Hopefully we'll get out there to see you soon. Those are the reasons that we do this program, is to try to give you that data, as much information as I possibly can, because health is a do-it-yourself program. It's up to you to take control. It's up to you to change what's going on in your life. I mean, from incidental information, for example, like all the new studies that are coming out there with the use of coconut oil in neurological degenerative diseases like Alzheimer's and Parkinson's disease and MS and so forth. It's anecdotal right now, meaning it hasn't been thoroughly researched, but we do know it's not going to hurt you. And there's so many studies now that says that at least it helps. It will at least prevent. It will begin to retard. It begins to reverse. And those are the things you need to know about. You need to get online and do your own research. And when you want more data, you get here, you call me, and we'll go back and forth, and I'll tell you if I know, and I'll tell you if I don't know enough. I'll tell you if it's something that I would do or allow my family to do. In the meantime, let me know what I can do for you. Let us know what topics you'd like to discuss. But we're here every Sunday, and I'll see you next week at 12 noon.